Have you ever visited someone in the hospital or had a recent medical procedure or hospitalization? You may not realize it, but a dangerous germ could be quietly spreading in those settings. Today, we're talking about one of the most serious bacteria called CPO. Don't worry, we'll keep it simple, and by the end of this video, you'll know exactly how to protect yourself and your loved ones. CPO stands for Carbapenemase-Producing Organisms. That's just a fancy way of saying it's a type of bacteria that can't be killed by many antibiotics. CPO are dangerous bacteria found in healthcare settings. It can cause serious infections, especially in vulnerable patients. It's important to understand that CPO don't usually make healthy people sick. But if the bacteria get into the wrong place, like the lungs, blood, bladder, or surgical wounds, they can cause serious infections, and they can be very hard to treat. You don't get CPO from the air. It is not an airborne illness. It spreads mostly through contact, unclean hands, contaminated surfaces, and improper cleaning of shared medical equipment, to name a few. People in hospitals, long-term care homes, or congregate settings are most at risk, especially if they have a weakened immune system, are on antibiotics a lot, have a catheter, wound, or feeding tube. People who frequently visit healthcare settings, especially those with poor sanitation, are at higher risk of CPO infection. Here's how to protect yourself from superbugs like CPO. Always wash your hands, especially after using the bathroom and before eating. Use hand sanitizer when soap and water aren't available. Be sure to wash your hands thoroughly after visiting someone in the hospital to prevent bringing germs home. Ask your doctor or nurse to clean their hands before touching you. It's okay to speak up. Only take antibiotics when you really need them. Keep things clean. Wipe down shared surfaces like bathroom counters, light switches, and doorknobs with regular household cleaners. Don't share personal items such as towels, razors, or toothbrushes. Keep wounds clean and covered. Simple? Yes. But these small actions can stop a superbug in its tracks. If your loved one has CPO, there's no need to isolate them at home. Unlike hospitals, where extra precautions are taken to protect other vulnerable patients. At home, caring for someone with CPO is all about basic hygiene, not strict isolation. In fact, by following a few simple tips, you and your loved one can keep enjoying each other's company safely. A simple way to keep everyone safe is to wash your hands before and after caregiving, and avoid sharing personal care items. Regularly clean and disinfect high-touch surfaces such as toilet seat, bathroom handles, faucet, door handles, bedside tables, and phones to help prevent the spread of harmful bacteria like CPO. Wash laundry in hot water with detergent. You don't need to separate items unless they're heavily soiled with body fluids or wound drainage. Remind your loved one to practice good hand hygiene. And don't worry, it's perfectly safe to give them a hug. You don't need to be afraid of superbugs like CPO, but you do need to be informed. By practicing good hand hygiene and supporting your loved ones at home, you can help stop the spread. Like this video if you learned something new. Share it with someone who might benefit. Subscribe for more practical health tips, because staying safe starts with being informed.